Welcome to Culture Shock Therapy, your health equity prescription. I am your host, Dr. Katrina Gipson. Thank you so much for joining me. And as some of you may know, July is Disability Pride Month. We celebrate this month to mark the anniversary of the passage of the Americans with Disabilities Act in 1990 and to recognize the achievements, experiences, and struggles of people with disabilities. So I thought this would be an excellent opportunity to discuss my article and some of the issues that it breaches. When you know better, do better for people with disabilities. This was published in MedPage Today in June of 2023. I realize for some of you, this may be your first time joining us, so let's have a brief recap of our first episode. Last time, we talked about who this podcast is for and what to expect moving forward. Anyone who is a member of the healthcare community or who seeks healthcare will find our discussions delving into the social drivers of health, health policy, pop culture, and their impact on health inequities informative and empowering. So let's talk about addressing ableism in healthcare. One thing that a lot of us don't think about is that disabilities are another form of diversity and thus a source of inequities. Before we get started, let me share with you all a little bit about myself. I was born and raised in Ann Arbor, Michigan, so I am a Midwestern girl. And I headed to the East Coast where I got a Bachelor of Science in Biomedical Engineering from Yale, came back to the Midwest to attend medical school at Case Western Reserve in Cleveland, Ohio. I stayed for my emergency medicine residency training before heading to DC, where I obtained a health policy fellowship at George Washington University. And I have been in Atlanta, Georgia as an assistant professor of emergency medicine at Emory for the last 6 years, I guess. I also serve as our department's founding health policy fellowship director. I'm president of the Academy for Diversity and Inclusion of the Society for Academic Emergency Medicine, or SAEM, and co-chair of the Education Committee for its Equity and Inclusion Committee. I also am the secretary of the Emergency Medicine section for the National Medical Association, or NMA. Now, of course, titles are one thing, but justice, equity, diversity, and inclusion provides a lens through which I focus my career and advocacy. So why did I pursue a career in emergency medicine and health equity? I truly believe that healthcare is a basic human right. So many social drivers of health, whether it be disability, race, gender, socioeconomic status, or education, impact access to care, the quality of care you may receive, and all of these variables perpetuate inequitable outcomes in healthcare, such as differences in maternal mortality rates, higher risk of death and complication from diseases such as COVID, diabetes, hypertension. All of these things are directly related to the type of access that we have to healthcare. And as some of you may know, emergency departments are the safety net for the healthcare system. If you are uninsured, underinsured, the emergency department will not turn you away. So with that being said, we see how the social determinants of health perpetuate inequities in healthcare outcomes. Those without insurance and resources who can't access a primary care physician to treat their hypertension, they may end up in the emergency department with a stroke down the road, as opposed to being able to get the care that they needed to prevent these poor outcomes. So you may be asking yourself, how is ableism a part of health equity and how does it impact it? Well, when we talk about DEI, diversity, equity, and inclusion, we tend to focus on race, gender, sexual orientation, and of course with good reason, but disabilities are just another part of our identities. The intersection of all of the ways that our identities collide and impact our experiences with the world and healthcare matter. Doctors, providers, anyone who works in the healthcare system are subject to our own implicit biases or unconscious assumptions about how people think, act, or behave. So what is ableism? In order to have an intelligent conversation, we need to be on the same page about certain definitions and make sure we know what we're talking about. So, ableism is a set of beliefs or practices that devalue and discriminate against people with physical, intellectual, or psychiatric disabilities. It assumes that able-bodiedness is the norm or that people with disabilities need to be fixed. This is a definition that is adapted from Leah Smith. She is a disabilities advocate. Look her up. She's done a lot of great work. But how does ableism manifest itself in the healthcare setting? Ableism is a complex topic. It's the physical environment in which we interact with people with disabilities and deliver healthcare. It's the language that we use when speaking to people with disabilities. It's assumptions about sexual activity, the ability to participate in one's care, or one's quality of life. Ableism and how it impacts the care of people with disabilities rears its head in the healthcare field all of the time. I wanted to share with you all a story about a time when I was taking care of a woman in the emergency department with who was in a wheelchair. One of my residents went to go see the patient. She'd come in with abdominal pain. As many of you know, that is quite a common chief complaint in the emergency department. He came back ready, to discuss with me what he found, his physical exam findings. And then when he was done, I asked him, I said, well, did you ask her if she was sexually active? And he responded to me, oh, well, she's in a wheelchair. So I went to go reassess the patient, and it turns out that she was, in fact, sexually active. We offered her a pelvic exam in search of sexually transmitted infections and had a conversation about safer sex practices. Now, based on the assumption that someone is in a wheelchair, assuming that they're not sexually active, that may have led us to miss important diagnoses, including ones that could have robbed her of her reproductive health moving forward. So it's important to take into consideration that just because someone is in a wheelchair, it doesn't mean that they don't live a full, active life, including they may also be sexually active. We corrected the issue, we moved forward, we addressed our own implicit biases when it comes to people who may have physical disabilities, but this is just one of the many ways in which ableism can impact the type of care that people with physical disabilities receive in the emergency department. I'm sure a lot of you have been paying attention to all of the anti-DEI legislation that has been popping up around the country. And one of the states that is really on its anti-DEI push is Texas. And the Texas Senate Bill 17 was approved in April of last year along party lines 19 to 12, and it became effective in January of this year. It requires universities to close their DEI offices. The bill would also ban mandatory diversity training and restrict hiring departments for asking for diversity statements, essays, and et cetera, when we are attempting to hire or in the admissions process in public universities and public organizations. So we ask ourselves, what does this mean? What are the broader consequences of this particular bill for the rest of us? Well, the impact on marginalized groups is vast, is broad, and it has a potential to be devastating. It also impacts people with disabilities. The DEI movement is really beginning to embrace persons with disabilities. We're very familiar with the acronym DEI, but we'd like to add the A for accessibility, and not just physical accessibility, but creating a culture in which there's inclusivity is valued for all people, regardless of their race, gender, socioeconomic status, religious beliefs, or disability status. So Texas Senate Bill 17 makes it difficult to consider the spectrum of experiences during the admissions and hiring process. It makes it difficult to create an environment where we can discuss our identities and how they impact our experiences and how we interact with the environment. It also makes it very difficult to promote the use of inclusive language and environments that make all employees feel valued and heard. Let's discuss a few strategies for anti-ableism in healthcare. I'm sure that we're all familiar with racism and the term anti-racism coined by, or at least popularized by Dr. Ibram Kendi. Well, the parallels exist when it comes to discussing ableism. It's not just enough to not use outdated terms like the R word or refer to someone with a physical disability as crippled. You must be a little bit more proactive, and with that comes being anti-ableist, being proactive in creating language, physical, and cultural environments in which all people are not only included, but valued. So what can you do at the individual level? First, take a moment to check and address your own personal biases. Now, a lot of these biases that we have may be implicit or unconscious, so you ask yourself, well, if that's the case, what am I supposed to do about it? Well, good question. All you have to do is take a moment and pause. When you see a patient who's in a wheelchair, or he communicates using American Sign Language, or also take into consideration that some people have disabilities that you can't see. That doesn't mean that their disabilities also don't define how they interact with your environment or the healthcare field. So just take a moment to stop and acknowledge your own implicit biases. And if you don't know, ask. What types of terminology would your patient like to be used? Just like you might ask someone what their preferred pronouns are, the same concept can be used when we're talking about patients with disabilities. Also, you can advocate for DEI in your institution. What are your hiring practices? Are there any people at your clinical practice or your hospital who have disabilities? Are their voices being heard? Are there committees that take this into consideration? As far as holding your organization accountable to making sure that the environment is inclusive for people with disabilities, make sure that your hospital policies accommodate all patients. And remember that accommodations and accessibility also include the physical environment. I remember standing outside in the lobby in Grady, and there was a gentleman in a wheelchair who was sitting outside of the bathroom. And it took me a moment. I noticed him out of my periphery. I was wondering, maybe he was on the phone. Was he waiting for someone? But there simply was not a plate on the door for this gentleman to push, and so that he could open the door. I opened the door for him, and so that he could actually access the restroom. So if your physical environment is not set up in a way that enhances people's access, then that's one of the many ways in which it's going to make it difficult for them to access healthcare. Who wants to be in a position where they have to ask someone to open the door just so they can use the restroom, when the physical environment could easily accommodate those people without them having to ask or speak up? Another thing we don't think about is, our colleagues also have disabilities, whether they be neurodivergent, physical disabilities, or they members of the deaf community. These are all things that we should take into consideration as well, because we have to remember that people with disabilities are thriving, they're accomplished intellectuals, and they work side by side with us. And it's important to make sure that our environment accommodates them, that their voices are being heard, and that they also have the platform in which to share with us ways in which we can be allies to their community. Well, what about legislative advocacy? So, advocating for policies that support DEI and protect marginalized groups. As I've said before, and for all of us who've been paying attention, DEI is under attack in so many ways, and disabilities are a form of diversity. So, people with disabilities will continue to suffer in the workplace, as well as in at higher education institutions, when their thoughts, their concerns, and their issues are not being heard. So you're asking yourselves, well, what can I do? If you're a member of a professional organization, make sure that the voices and concerns of people with disabilities are on the agenda. Center those people. Ask how you can be an ally, and know when to decenter your own voice if you happen to not be a member of that community. If you're wondering who your representatives are, you can go to house.gov and search for your representative by your zip code. Because as we know, your zip code can determine your healthcare outcomes more than your physician or the medications that you take. Hold your representatives accountable. They serve you. Make sure that bills such as the Senate Bill 17 that unfortunately passed in Texas don't pass in your state or in your area. Hold them accountable. They serve us, and make sure that they're serving the needs of people with disabilities and people from all backgrounds. Remember, there are many ways in which you can contribute to promoting anti-ableism in your practice, your hospital, or your everyday life. Join or start a committee at your hospital addressing disabilities. Make sure that your physical environment is accessible to those who need it. Make sure that interpreters are available for the deaf community, or what other ways are needed to facilitate communication for those who may not communicate like the vast majority of your patient population. Make sure that you are educating yourself. July is Disability Pride Month. Go online and see what's going on in your area as far as volunteer opportunities, legislative drives and or pushes. And remember that DEI is one of the major ways in which we can educate each other, learners, and our colleagues about persons with disabilities, their accomplishments, their achievements, and their everyday struggles. So if you take nothing else from this episode, please remember that disabilities are a form of diversity. Ableism is a system and set of beliefs that devalues people with disabilities, assumes that they need to be fixed or that they somehow have a decreased quality of life, and takes steps to be anti-ableist. It's not just enough to be anti-racist, but also be anti-ableist for our colleagues, patients, and our communities who have various forms of disability. And if you enjoyed this episode, we have some more exciting things coming for you on episode 3. In the meantime, make sure you visit my website at katrinagipson.com and continue to be an anti-ableist during the month of July, as well as for the rest of the year. It's a month and it's a movement. Thanks for joining us on Culture Shock Therapy, your health equity prescription.
Olá.